Let me show you what we will need in order to do this procedure. So we'll need this sponge holder, first to clean it, and secondly we'll use this circle to localize the inferior aspect of the sacroiliac joint. Now this is some 1 or 2% lignocaine. We have taken 5 mils to anesthetize the area. Then we have got 22 gauge spinal needle. We have got Omnipaque. This is the dye to localize the correct position, and this is what we will need. Now the next step will be to show you the radiology of the sacroiliac joint as what to localize. So if you see this, when you are taking a straight shoot up view, then you will see only the inferior aspect of the joint, the superior or the middle aspect of. So if you see this view in which you have got 15 degree of tilt, then you will see all across the sacroiliac joint. But the most important part is the inferior part. So what I am going to do is I am going to realign my C-arm back to neutral position and then localize it and then insert my needle. So now I am just using the one edge or the handle of the sponge holder, and I am going to localize the inferior aspect of sacroiliac joint. So I have taken a shoot and I will show you what I mean by that. So this is what you want to see, because our needle is going to enter from the inferior aspect. So this is our main area where we want to focus on. So once I have localized it, I am going to mark it with a marking pen, and then I am going to insert local anesthetic first. So now I am taking a 5 ml syringe with the local anesthetic, and I am going to localize the inferior aspect of the sacroiliac joint, and I have taken a shoot, and I will ask Akash to show what I mean by that. So once you can see that my needle is just on the medial aspect of the sacroiliac joint, that is the perfect position. So my next step will be to just take my needle vertically and inject this tract so that I can inject or put my spinal needle without much discomfort to the patient. So I'm just going to go vertical and then inject the whole tract with the sacroiliac joint. So just go vertical, keep aspirating and inject the local anesthetic to make that tract pain free. So wait for a few minutes for it to act. Then your next step will be to insert the spinal needle. So what I do is I take a sponge holder and hold the spinal needle with it, so that you're not exposing your hands while taking the x-rays, and then we will take a shoot and I will show you how it should look on a C-arm. So if you look at the C-arm images, you can see that our needle is in the inferior aspect of the joint and it is pretty central. Now ideally it should be close to the medial wall and then you slide it, but I am happy with this position, so I'm just going to proceed in the same direction till I feel a giveaway of going into the joint. Now once you take this spinal needle, this particular patient is quite obese, so a lot of needle has gone inside. In thin patients it won't be that difficult. So what it needs is, once you keep going in, and your idea is, because your C-arm is perpendicular, you just keep on following the track of the C-arm, you will end up in the joint. You will feel a giveaway when you enter the joint. So on this occasion I felt a giveaway. I think I am in the right place. My next step will be to put some Omnipaque dye and then confirm the position. So now I am put some dye in, and if you look at this 0 degree, it may look like as if the dye is not in the joint, but this gives me confidence that this is in the joint. Now I am going to take a 15 degree tilted view, and then Akash will show you how it looks. So now if you can see, our needle position is quite perfect inferiorly, and the dye is now going nicely into the joint. I have not put enough, but if I wanted to put more, it will go up to the top. So don't worry if it doesn't look like it's in the joint on AP. Take a 15 degree view and then it will give you a clear indication whether you are at the right place or not. And that is one thing when you are injecting the sacroiliac joint, because the joints are at an angle. So in some patients you may get away with 0, in some patients you may have to use 15 degree tilt, in some you may need to have both. Like on this occasion, it was looking out, but when you take a 15-degree tilted view, it is in perfect position and dye flow is beautiful. So the next step is to just inject a mixture of steroid as well as lignocaine. So last thing is just to put a mixture of some steroid as well as lignocaine. The patient does feel some sense of pressure. So just be slow and just keep on injecting it. So now once we injected, we had some difficulty. We managed to inject around 3 ml, and after that I think needle moved, so we had to reposition it. But once you give the local anesthetic and the steroid, the dye should wash off, and that confirms that you have injected in the right spot. I think one of the best thing that you can use is a connector. We didn't have access to the connector, so that once you are in the right position, just use the connector so that the needle doesn't move. But this is how you inject.